Uganda is among the 30 countries across the world with a high tuberculosis burden. This highly infectious disease mainly affects the lungs and can destroy up to 80% of the lungs. The Ministry of Health reports that approximately 30 people in Uganda die of TB daily, and the majority being people living with HIV/AIDS. Tuberculosis spreads through coughing, sneezing, and about 70% of the patients tend not to complete the 6-month dose, thereby exposing them to multi-drug resistant TB.
The difficult part about it is that there are those cases that we don't find and we don't bring to treatment. Yet we have all the facilities for screening, all the facilities for testing them, and all the facilities for giving them treatment free of charge.
Now, when you don't complete your treatment, you have caused the germs to become a little bit stubborn to the TB treatment, the medicines themselves. So you may come next time, first of all, the disease is not cured, so the germs are still with you in the body. So at any one time, they will come up again and cause you illness, and you fall ill, and you may die because TB kills.
But the important thing is to encourage them, to give them morale. He said, don't give up. You will manage. It is just 6 months.
Some of the TB symptoms include coughing for 2 or more weeks, prolonged fevers for more than 2 weeks, excessive night sweats, coughing blood, unexplained weight loss, chest pain, swollen lymph nodes in the neck or armpits, poor weight gain among children, among others. The Health Ministry has a program to trace TB patients through community engagements, mobile clinics, among other interventions. The ministry also plans to acquire 21 X-ray machines to help in examination of TB.
Removing those old ones and replacing them with modern digital X-rays. Because these days we are going digital. And we are getting those new X-rays which no longer require film, dark rooms and whatnot. We are getting modern X-rays. 21 will soon be arriving and will be sent to our general hospitals, thanks to Global Fund, and the rest will be arriving by next year. So we are improving the capacity for diagnosis of TB. But of course, when these X-rays come also, they are not strictly for TB alone.
In addition, the Ministry of Health has introduced preventive treatment for high-risk population, including majorly caretakers, HIV patients, among others.
If you have somebody in the home that has got that TB and has made the germs in the air that you share with them float in the air and you breathe them in, this preventive therapy helps you to ensure that whatever germ that has entered your body you don't progress to disease, to get the symptoms that we have shared again today.
The effort to bring down high TB burden has come with its challenges, including stigma and patients not completing their drug doses. The ministry is calling for support to bring this to an end.
If I got TB, it does not mean that I'm condemned. And it does not mean it is my fault. And it does not mean that if I'm in the family, I should be discriminated. People should know that TB is a disease like any other.
Uganda is set to join the rest of the world to commemorate the World TB Day on 24th March 2023. Prior to this, the Health Ministry will conduct community outreaches for diagnosis and treatment. TB can be prevented by immunizing children at birth, early testing and treatment, covering the mouth and nose when coughing or sneezing, having a good number of windows on the house to allow proper ventilation, avoiding crowded places, among others.